tena mtazamaji wa kipindi cha Mental Health, au ukiwa mahali popote pale uliko, mimi natumai uko salama ama upo buheri wa afya. And of course najua kuna watu wanatazama runinga ya MASSA TV ukiwa mahali popote pale uliko. Karibuni sana watu ambao mnatazama mkiwa maybe ni Eldoret, Nakuru, Kiambu, Nairobi, wherever you are. Karibuni sana hapa kwenye studio zetu na pia kwenye kipindi cha Mental Health. Hapa ni mahali na ambapo huwa tunaongelea mambo tofauti. Kama the last episode tuliongelea mambo na depression, pengine tukaongelea vile na ambavyo watu wanapitia stress hapa, maybe kazini, maybe kwa nyumba, maybe kama ni familia, and a lot of things tumekuwa tukiongelea. But now kuna mambo na ambayo pia tulikuwa tunapitia, maybe maswali na ambazo watazamaji walikuwa ama mlikuwa mnauliza. Sasa leo ndio tumekuja kuwajibu hayo maswali. Na hapa kama kawaida mimi naitwa presenter Gilbert, na ukiniona hapo unajua mambo yote itakuwa iko sawa, itakuwa iko mufti kabisa. And of course in the house tuko na our very own psychologist Grace Lucy. Welcome so much.
Thank you.
Karibu sana. And on behalf of the viewers and everybody that is watching, you look so amazing.
Thank you.
Na najua ukiwa hapa mambo yote iko sawa. Maybe you can just say hi to the viewers, and of course it will be a blessing.
Thank you.
Karibu.
Mtazamaji wa MASSA, natumai umekuwa vizuri. We thank you for joining us in our episodes. If you've missed in the past episodes, today is our third episode.
Yes.
Make sure to catch us up on our YouTube channel,
Yes.
MASSA TV, right?
Yes.
Yeah, so today we are here because we've received the questions you've been asking, and we are here to continue journeying through the mental health with you.
Yes.
We hope Kenya tunajadilia hapa is able to help you, help your neighbors, and also help you be a blessing to someone else.
Very true.
Yes.
And if anybody has a question, anaweza uliza, because the number is down there on your screen. Maswali kama yenye tutapitia saizi ni maswali watu waliuliza, kwa hivyo pia there are some question yenye maybe you have to ask today. Make sure umeuliza, alafu the next episode tutakuja tutawajibu. So we were going last episode we were talking about depression.
Yes.
We were having a lot of questions yenye watu waliuliza from the last episode. So this one, wakati tulipitia depression, mtazamaji, watu walikuwa wanauliza many question were about even drug abuse. Yes. Mambo mingi kuhusu vile ambavyo watu wanatumia madawa. Maybe you can tell us a bit of maybe drug abuse ama what is now drug abuse itself.
Okay. Thank you very much.
You're welcome.
And drug abuse is a very broad topic.
Yes.
That we are going to touch a bit about it. Okay. And in our current society, it is the most prevalent. It's the most prevalent thing that is happening, and that's why today we are going to talk about drug abuse.
Yes.
In clinical term, we call it substance use.
Okay.
Substance use disorder. But now when we talk about substance use, that is just one disorder, and there are so many other disorders amongst it, down on it.
Yeah.
And the substances we abuse are the drugs we use.
Okay.
They could be illegal drugs or legal drugs, because there are some people who go to hospital, they are given medicine or over-the-counter medication, but they don't use it according to the prescription.
Okay.
Wanajipea tu dose yao for different effects.
Ama ni ile yenye inafikaga mahali mtu anasikia mimi ni mgonjwa, hajui mgongo, anaendea dawa direct, but hajui kama itamsaidia.
Yes, there is that. And also kuna, for example, if you take an example of Piriton, ukienda kwa hospitali, daktari atakupea Piriton ndio ufanyie nini? Ya homa. But wewe ukienda usiku ukose usingizi unasema
nataka Piriton.
That is drug abuse in itself. Yes. And so today tukiongea about substance use, we are going to tackle on all that. And in this substance use disorder, we will talk about intoxication, we will talk about addiction, and we will talk about withdrawal. All those are stages, are not as stages, are parts of the substance use. Disorders that result from the substance use. Yes.
Wow.
Yes.
So like right now, can you just tell us, are there any maybe types of drugs used ama what kuna kuwaga na types of drugs used?
Yes, kuna most of the drugs hukunje zina abusiwa, and I know our viewers out there know most of them.
Yes.
And you can also be able to give examples. I'll just name just but a few. We can talk of alcohol, talk of cannabis, yenye huku nje inaitwa marijuana, it can also be called bang, all that. There is mira, there is cat, mira is also cat, there is mogoka, there are other types of
the
other
kubels and all that.
Kubels and other classification of drugs called hallucinogens. There are things like nicotines, there are things like opioids, there are things like hypnotics. All those are types of drugs that can be abused. The drug that you're taking to alter your brain. They are called psychoactive drugs. Yes.
Okay.
They have an alteration in your brain, and when you, so that we can be able to identify or diagnose that you're suffering from a substance use. It has impaired your functioning, your behaviors. It has functioned how your brain functions, even how you conduct yourself socially, how you conduct yourself physically in your job area. That's we have to look at all those for us to be able to identify that you have an issue with substance. Yes.
As we continue like this, I know we are now going to talk about now drugs in details. The last time we were talking about depression. Somebody here is asking, does drugs in a quote, alcohol or bang, can it make somebody be affected? Anaanza kukua like sasa ame go to depression.
Okay. The thing we said last time, mental health, it is like a chain. You start from this one, you go to this one, to the other one. So most of these things you find zinakoka. They intermarry. Maybe someone is taking alcohol because of depression. Maybe someone is depressed because of taking alcohol. It can appear either way. So what you're going to do, by your question, allow me to take you through what can make you find yourself in substance abuse. Wewe kama Gilbert,
or what are the reasons why people get into drugs abuse?
Wewe kama Gilbert, unajipata aje, you've been buried in this den of substance abuse. First and foremost, addiction can get to anyone. And before you know it, you don't take the drug first day and you're addicted. Unaanza kidogo
It's a process,
and before you realize it, it has gone out of control. But again, we are going to get there. How do you know it has gone out of control? But before then, some of the reasons that make people abuse alcohol, they are very basic. For example, peer pressure. Wewe kama Gilbert umetulia tu, mabishti wako wanachoma, kishash kila wakati, and you really want to fit in like
in their shoes, and you want to do what they are doing.
Mbona mimi nisitumie, and kidogo if you're not firm on your principles, unajipata
umeshaingia.
Ushaanza. Leo unavuta moja, unapuff moja, unasikia ina si mbaya. Kesho yake unapuff mbili. Siku ya tatu unaenda kwa bishti yako nichome. Siku ya nne hata ndo unamuuliza tunatoanga wapi. And before you know it, you're so deep into it that huwezi jitoa hapo. So you see that has been one, peer pressure. Na ukikuja kwetu, we will ask you, how did you learn about this drug? If your drug of choice is alcohol, ulijua aje kutumia? Where did you get? Who introduced you? That is, peer pressure is one. On another one, we can use it for coping. Someone can use it as a coping mechanism. What do I mean by this? You've asked about depression. Ama mtu anatumia pombe, depression and all that. Sometimes mental health ikishika mtu, you don't know how to cope with it, or even other life life events that are stressful, you don't know how to cope with it. If you get a trigger, as the best example napenda kutumia, you've been laid off at work. You don't know how to deal with that. So unajipata, you've buried yourself in alcohol. Atukiamsha tu kichwa hivi, unataka kuenda kukunywa, so that you bury the pain, you bury because you don't know what
to do. You try to forget something.
Yes, that's the word. You try to forget. You're trying to forget that you've been laid off at work. So the first week passes, you're still doing that. The second week passes, you're still doing that. By the time that week is going to be, that is already a problem, because now you see you're using alcohol to cope, but it is not helping. So people use it as a coping mechanism or as an escape, to escape away from your troubles. That is the second reason. The third reason, it could be genes. Genes in that kwenu, the reason, not the reason why you're using alcohol, why you got maybe addicted. Maybe in your family, there's something called an X factor, for example, for alcohol. If you have that X factor for alcohol, and you try taking that alcohol, itakufanya umejipata addicted. Or maybe you're taking that because people from your lineage wamekuwa wakitumia. Kaka yako alikuwa anatumia pombe, babako alikuwa anatumia pombe, wewe umejipata unatumia pombe, pombe. So even the probability of your son using it is going to be high. But again, this one, you can learn and you can unlearn. That is another thing. Another reason is how you've been brought up. An example, maybe Gilbert, you were raised by your dad akikutumanga sigara. Unaenda huko kwa barabara unamletea sigara. Your dad is like your role model. So ukiona akivuta sigara, so in you know it is not a bad thing.
Unaona ni kama he is doing the right thing.
He is doing the right thing because to us as children, in the eyes of your children, you're always right. Haya, maybe you've grown ukimwona akitumia pombe. So you, in your eyes, it is not a bad thing. If you grow up, you can take two paths. If you saw how alcohol affected your dad, you can choose not to do it, or you can choose to follow the example of your parent. So this reason is a reason enough for you to start using. Si babangu alikuwa anatumia. You can start using, and you can also not use because of that. Useme, mi vile nimeona dada ki-struggle na alcohol, I don't want to go through that. So you see, you've taken another path. But that same reason can make a different person do the opposite. It's like in a state of twins. Twin moja anagrow hata iguza pombe, and the other one grows anakuwa drunkard. But you see, they both used the same example. So those are some of the reasons. Another reason could be because you want, we say because you want to fit in. Another reason is the company you keep. If the company you keep, the things they do for fun is alcohol, if apart from it being from peer pressure, kama company yako, the things you do together ni kutake alcohol, then why not? Hata wewe utajipata because you want to be among them, na zile vitu mnafanya, what you share in common is alcohol drinking, you'll definitely use that. Kama ni kuchana jaba, hiyo ndo utatumia. Kama ni weed, that's the same thing you're going to use. Yes. I don't know whether you can be able to relate to any of those reasons. Have you seen people go through that because of some of the reasons?
True. Actually, a lot of people, in life, lazima ujue the people that you are working with, ama the people that are so close to you, you see, ama unapatana, ama mtazamaji unaweza tuambia pia, watu maybe ni marafiki wako, the people that you yourself you associate with, tabia zao ni gani? Because kuna venye hata sisi unapataga when we were growing up, kuna watu walikuwa na tabia zingine, but because sisi kwa venye saa tulilelewa, like our dad was not a drunkard and that, so when you see your friends are doing that, because they are like, hey, me, I'm not going to associate myself with that. But unaona on the other side, those people, they are doing what it's like they are enjoying.
They've enjoyed.
Very, very true. So it's a lot.
So as we continue, some of another reason, it could be for experimentation purposes. Maybe kama wewe Gilbert umeishi kusikia, hey, kuna vile heroin inainuanga mtu,
inapea mtu steam,
inapea mtu ma steam, and you like, hey, let me just try nione ama
ama ni feel venye watu wana feelingi,
ni feel ama vile wana feel. So if you take that na upata hizo mahandas, zinaitwa handas, if you get the handas and kesho usikie, let me try again.
Zinaitwa handas. Handas
kidogo, hiyo ni jina ya mtaani. It is not a scientific name. Hizo ni jina ya mtaani. If you ask some of them, najua watazamaji wetu wanazijua how they call, ukikuwa na hiyo highness, the act of feeling high, because of that unaambo uko na mahandas. Hata watu wa Java wanasikianga hizo. So if you get that and you feel good, tomorrow you'll use again and on. But it is started as a way of experimentation. And now the reason I want us to sum up with is mental health illnesses.
Before you go to that, I remember there was some back then when I think hata mtazamaji or you can relate, when we were in high school, there is this ilikuwa inaitwa ethanol or something. Hiyo kitu watu walikuwa wanatengeneza. Actually I was one of them. Of course I know you are there and everybody, the viewers that are watching, they walikuwa wanatengeneza hiyo kitu, walikuwa wanatengeneza, and it can be alcohol at some point. Yes, and people are drinking it, and it was because ulikuwa unaona, unasikia ama mtu amekwambia like mimi nilitengeneza nikakunywa na unaona huyu msee ni mlevi, but because of the peer pressure unataka kuona hebu acha nijaribu nione venye itanipeleka, and it was bad.
Wanashangaa walevi
wanatoka wapi na pombe yenyewe inatoka kwa lab.
So you see that was as maybe peer pressure or experimentation. Moving on in life, if this person gets to addicted to or gets used to that feeling of being drunk, akitoka shule unajua hakuna limitations, atatumia tu.
Anataka kujicontrol sasa.
So huyu mtu akikuja kwako maybe ashafika place imemweza, utamuuliza how did you learn about this? Na atakwambia nikiwa form 2 nilikuwa natengeneza. So you see it started as a simple joke of experimenting. So even you as parents, mtoto wako akiwa pale shule, be interested in knowing what does this child do? Ni vitu gani kwa curricula zake? If this child goes to the lab, anaenda lab kufanya nini? So that we don't get a mountain out of this little anthill that you could have cut down akiwa tu shule bado.
Yes. Very true. You are mentioning something about there's something you want to say?
Okay, yes. If you allow me, we are going to sum up the reasons with mental health illnesses. Last week we talked about depression, right? So this person, and we said the symptoms of depression, how it comes about, and how it can be treated. If someone starts getting depressed, you're suddenly in a low mood, you're suddenly lonely,
it was hypertension
or insomnia. So you don't know what's happening to you because the beginning mtu ajuangi. You just experience these different changes in your body and you don't know what's happening. And you start to wonder, what is happening? That is just one example of something like depression. Let's talk of something like schizophrenia. You're hearing voices. You're seeing people. Those are called hallucinations. Kuna mtazamaji wetu alituuliza schizophrenia ni nini. We are going to answer that along the way. But one of the signs of schizophrenia are hallucinations and delusions. So if this patient is having hallucinations, hallucinations is where you get to, you see things that do not exist. Tumekaa tu na wewe hapa Gilbert nakwambia, si huyu ni mtu naona akikula ugali. But wewe uweni, but I have that mental image, so I can see that. Or we are seated here and I'm telling you, I can smell gas leakage. But honestly, there is no gas leakage. That is called olfactory hallucination, where you smell. There can be auditory hallucination, which is what you hear. You're hearing voices talking to you, but uzioni. You see, that's a very disturbing thing. Kama hujawai experience. And you need to cope with that. So as a reason, you find yourself burying, yourself in drugs, in alcohol, in weed, in mirror, to try and suppress the voices you hear, to try and suppress the images that you see, to try and cope, just to feel ni kama sasa uko kawaida, because those things can be
sasa kujaribu kufocus.
And kujaribu kufocus because those things can be disturbing. So those are just some of the reasons why people take alcohol. They are not limited to that. Mtazamaji wetu unaweza kwa maybe you have a different reason why you started using drugs. Please make sure to alert us, to tell us about it. Tell us how your journey have been with drugs, because we are getting these so many questions. My husband is drunkard. Sijui I have been drinking myself crazy. How do I get out of that? Please make sure to use the number below here and tell us about those experiences.
Very true.
So I would love to put an end to the reasons, but they are not limited to those. There are so many.
So as we are going on, nataka kuambia mtazamaji kwamba nambari ya simu ambayo utatumia kuuliza maswali iko hapa chini ya screen yako. Make sure you any burning question uko nayo unaweza taka kuuliza our psychology here. You can ask any question na itakuwa ya msaada sana, because sio wewe tu utajisaidia, hadi itasaidia maybe ni friend, maybe ni family, ama whoever that is maybe mwenye ako karibu na wewe. On the other side, nataka nikukumbushe kwamba tumekuwa hewani sisi kama Mental Health Show, tumekuwa hewani hapa kwenye studio za MASSA TV na The Tag Hotel. The Tag Hotel iko pale ukipita Thika Road, ukisimamia kunaitwa Juja. Ukishukia Juja kuna hiyo njia inaitagwa Off Gatundu Road. Ni kama unaenda Gatundu, unaingia hiyo njia mahali kunaitwa Mirimaini. The Tag Hotel iko pale, kuna accommodation, kuna wifi, kuna parking, chakula ni nzuri, kuna restaurant, kuna club, yani mambo yote iko hapa hivi. Kuna Airbnbs, ukikuja hapa mambo yote itakuwa iko sawa kabisa. Kwa hivyo make sure ukimepitia pale The Tag Hotel, na nakuambia pia tutaweka nambari yao hapo, na watakuwa na ukienda pale utakuwa maybe na familia yako mtakuwa mko sawa kabisa. So let's go to another question here. There's somebody that asking yani napitia maswali hapa, so I'm just trying to gather the question in one.
Yes.
Kuna mtu anauliza how does one know that the drugs that anatumia is out of control?
Okay.
Yes.
Thank you. That's a very good question. Because you know when you're using this drug, it just doesn't affect anyone. Kuna mtu atatumia pombe Monday to Friday na ako tu sawa, anaamka kawaida akienda job. So for you to know now this one needs help, isha go out of control. And remember, sio alcohol peke yake, even the other drugs. For alcohol majorly it is used for leisure. That's why I'm talking about alcohol. But something like weed, never tell yourself that you're using that for leisure. It will go from 0 to 100 on you. And before you realize, you're my patient at a mental hospital pale Mathare.
Yes.
Because that thing it goes from 0 to 100. Cannabis, heroin, cocaine, those are not things that you say you're taking them for leisure. You're abusing that. But for alcohol, it is not such harmful, but it is harmful taken in excess measures. For you to know now that this thing I am taking is out of control, I will use the example of alcohol. Ukiona umeenda ulikuwa umeintend uingie club, utumie for how many minutes, for maybe an hour, and go home, but you're unable to leave the premises because you want to continue using, then know that's a problem. You're not able kujitoa hapo. If most of the time your time you use it kutafuta pombe, kutumia pombe, ama recovering from the effects of the drug, you're in danger. If ukiamka now, and ninaenda step by point by point, we're in the third one. If you wake up and you have the urge to use alcohol so that you can go on your day activities, basis, then it has gone out of control. Tunawaitanga DDO, daily drinking officer. Lazima akunywe kila siku for them to be functional. Lazima aende atoe lock. You see, kama umefika mahali pa kutoa lock, then it has gone out of control for you. Haya, the other one is if ulikuwa unaingia club, unakunywa taska mbili and you're okay. But now unaingia taska mbili hazikufanyi anything. And for you to feel the effect you used to feel with 2 taskas, they've gone up to lazima utumie kama 6 hivyo. Ati lazima nitumie 6 taskas ndio nisikie vile nilikuwa nasikia nikitumia 2. Then that one have gone out of control. If you were using 1 stick of cigarette, but now you have to take like 3 for the same effect, it has gone out of control. If whatever you're taking is affecting your day-to-day activities, ati huwezi enda kufunction vizuri kwa kazi, lazima ujifiche kidogo, uende uchape makali, urudi.
Chape puff moja mbili.
Uchape puff moja mbili, urudi. You see, if you're having those sneaky behaviors, then you definitely need a help. If you feel you're craving for this thing, ati if it is alcohol, hauendi kuitumia kwa club ati juu unataka kurelax ama for social reasons. You're going there because you've been led there by a craving. You have a recurrent urge to use. You need help. If you're using alcohol as a coping mechanism, mtazamaji wetu out there, kama shida ndo zinafanya unatumia pombe, kama shida ndo zinafanya unatumia bangi, mira, you need help. Because these things, if you need to enjoy them or if they don't have to be a problem, you need to use them as recreational activities, social activities. But remember, nimekwambia, some of these things you can't just use them as recreational activities. They are going to affect you. So those are just some of the reasons. If you have the urge, kama you've been trying to cut down on your alcohol, umejaribu kukata but unashindwa. Your heart is willing, but your body haiwezi cooperate. Unataka kupunguza kiwango unachokunywa ama kuachana nayo kabisa. If it has ever crossed your mind that you need to stop using that drug, then it is time to stop before it goes out of hand. That is the number 1 sign that you need to know. Kama ushaikaa hivi Gilbert ukafikiria you need to cut down on alcohol, then that is a reason enough. It is a sign.
So talking of that, there's some people venye tu unapeana example, there's some people wenye wamekuwa kidrink sana, maybe let's talk of alcohol, wamekuwa kidrink so much alcohol, but msi anataka kuacha. Amejaribu na sasa ndio aache, lazima sasa akunywe kadogo akikataga hivyo. Has it ever worked to somebody?
sasa those are called self medications. Maybe ukienda pale base ndo unaambiwa wewe kunywa kidogo kidogo ukiacha. But if you need to real treatment, we are going to get to the treatment plan of these ones. This is how you need to get treated on substance use. Yes.
So right now I want us kwanza to stop here hapo because I want us to go for a short break. But kumbuka mtazamaji kwamba nambari ambayo iko hapo chini ya screen yako, uliza swali. You can ask any question. Our psychologist here, Grace Lucy, atakuwa anatusaidia ama atakuwa anakusaidia na utakuwa unajua what to do on matters of using drugs, matters of maybe mambo yenye inafanyika in your family and with maybe a close friend. Utakuwa unasaidika vile na ambavyo utaenda kumsaidia. Kumbuka tumekuwa hewani once again na The Tag Hotel. Wacha nikuwekee hapo, alafu utakuwa unatumia nambari yao hapo, ukiwatafuta, ukiwapigia simu, and then utakuwa mambo yote itakuwa iko sawa. We are going for a short break, usibanduke, we'll be right back.
Unajua leo nimesema nikuje nitembee. Sasa hapa niko Chucha. Hii ni barabara ya kwenda Chucha Vamu na ingine ni ya kwenda Thika. Na huku side yangu ya left kunasikia kuna hoteli inaitwa The Tag. Wacha niende nika-relax. Siwezi ishi kwa maandishi maisha yote. Kumbe hata sio mbali. Hapa ni pale nilikuwa nimekuambia hapa naitwa The Tag Hotel. Nimesema nitoke kwa maandishi nikuje relax. Hapa kutoka Chucha kukuja hapa kumbe ni kilomita 2 peke yake. Alafu nimepata kumbe kuna Airbnb ambazo wanapeana na offer na ni shilingi 3,500. Kuna nyumba zingine za VIP ukitaka kurelax vizuri ni shilingi 2,500 na kuna nyingine normal ni shilingi 2,000 na mpaka breakfast. Alafu ukitaka kuongea na MASSA TV, ukitaka kuadvertise anything, ni mashamba, ukitaka kuadvertise hoteli yako, utakuja hapa ofisi za MASSA TV ziko hapa The Tag Hotel. Na sio hivyo, hapa nimepata kwanza wako mpaka na kilabu, wako na purutebo, wako na DSTV, ati unaweza kuona bolu ama michezo yote unataka. Alafu kwanza security yao iko tight. Paka parking, unapata parking mzuri. Afadhali The Tag wapate Chucha milimani. Kuja tu enjoy. Hello.
You are watching MASSA TV. MASSA TV, where great things happen.
So once again we are back hapa ndani ya studio za MASSA TV tukiwa kama wana mental health show, and of course tunaendelea vizuri sana tena zaidi. Thank you for those that are asking question, tunazipitia zote. Pia kama hujauliza swali lolote, nambari ya simu iko hapo chini ya screen, you can ask right now, ama pia tukishamaliza pia ukiendelea kuuliza, ama if you feel like you have something to ask concerning health issues ama mental health ama anything that we are discussing about here, wewe uliza tu. Hapa sisi tukiwa hapa na our psychologist Grace Lucy, utakuwa unasaidika sana tena zaidi. We were talking about, ama we are still talking about drugs, venye drugs zina affect watu, venye how you will control them, and of course ndio tuende kwenye break. Nilikuwa nimekuuliza swali that there are some people wenye unapata they have been drinking so much alcohol and wanashindwa, yani alafu inafika mahali because they want to stop but itabidi tu wakatakate, maybe alikuwa anakunywa glass mzima but kesho anakunywa nusu hivyo. But there are some of them that sometimes unapata hata akijaribu kuacha unapata maybe kwanza watu wa sigara wana shake sana. What happens yani how can we help them?
Okay. Thank you very much.
Yeah.
Unakumbuka pale mwanzo tukianza I talked about addiction, intoxication and withdrawal symptoms. Once these drugs have been buried in your body. Zishajua mwili yako, zimezoea mwili yako. Mwili yako na drugs zimezoeana. You just can't wake up one day and say I'm going to quit. For example, kitu kama cigarette, it is one of the hardest drugs to quit. You just can't wake up one day and say I will quit na nimeacha. It is possible for some people, but most of the people, the highest percentage who are in experience what we call withdrawal symptoms, which we classified under substance use disorder. These withdrawal symptoms are symptoms you experience. For example, in cases of alcohol, you've been using alcohol continuously, umekuwa DDO, but now you're trying to stop. You wake up one day and you stop. It is going to give you some symptoms. And that's what you've just said, the tremors in the hand. Huyo mtu kama hajatoa lock ama ameamka tu amesema leo atakunywa, anatetemeka
ama kizunguzungu.
They will tetemeka until they take that alcohol, because their body is already used to the function, their brain is already used to being altered by the drug or the alcohol. In kama for example, if you use the withdrawal symptoms for alcohol, you'll get that, the tremors, you'll get the insomnia or the sleep disturbances. Wanalala while they are having nightmares. Ama hawezi kulala vizuri. These people are very nervous. They have anxiety. That anxiety is another topic that we'll discuss along the way. Wako anxious, they are sweating, their palms are sweating, they have psychomotor agitations, they are very restless. Mtazamaji wetu, those are some of the things that the symptoms that are called withdrawal symptoms. If you're experiencing one of those, jua, you just can't quit alcohol on your own. You need help to quit alcohol. And now, those are some of them. Another one.
And that's why you come in.
That's where we come in. In fact, vile unaona pala mahali nilikwambia, if you feel you've ever had the thought of quitting alcohol because it did something on you, that's where hata hungoji zifike kwa withdraw, kuja hapo. Before you start ukianza kuacha peke yako, you know it can even cause death. If you start like unataka kuacha pap, because of the withdrawal symptoms. And adding on to them, hizo withdrawal symptoms, there are things we call, there are visual hallucinations and auditory hallucinations. We've talked about them. Unaona mtu anaacha pombe, ako kwa nyumba, and there is another one, the third one is called tactile hallucinations. Watu wenye wanaacha pombe, if they experiencing withdrawal symptoms, anasikianga nikaa anaguzaguza huko. And I know mtazamaji wetu can attest to that. If you've ever tried that, you will feel like you are having things, someone is touching all over your hand, ama kama wadudu wanatembelelea mikono yako. You can see people or see things, you hear sounds, you're not able to sleep, you're having nightmares. All those are something, all those are symptoms of withdrawal. There's also impermanent, like visual blindness, not blindness, it's impermanent. Remember, where you experience problem with your visuals for that period when you're trying to withdraw without the help of a health worker. So with those drugs, it's hard for you to just quit. So zenye nime mention, they are just a few of alcohol. Also, kuna kitu inaitwa stupor. Na Kikuyu wanaita kadhitima. This one is where this person gets ni kama seizures. They get seizures where there's clenching, there's twitching of muscles. Huyu mtu anaweza anguka anytime. Ukiangalia ni maybe amezoea kutoa lock, ni kuanguka like a seizure. You know what a seizure is? Ni kama epilepsy. See what people with epilepsy go through. And ni kama amefaint. That stupor is what happens in alcohol withdrawal. And that is alcohol withdrawal. So if your body is used to the alcohol and you experiencing these signs, don't wait for them to get to the major signs. Get help from a health worker before you experience the serious effect, become the seizures, hizo kadhitima and all that. So
there's some people that are awasiki kadhitima. It is kastima in Kiswahili. Electricity.
But believe me, a person who've used alcohol and tried to stop can get when I say that electricity, because it is like a shock-like reaction. You see the way you're shocked by electricity and then you
shtuka.
That's how they feel. And even some of them,
they can
wanapata hiyo stupor, they fall down. So those are some of the symptoms za withdraw. That is for alcohol. There are for other drugs, but let me major on for cannabis. Cannabis ni marijuana, cannabis ndo kishash, cannabis ndo weed, ndio bangi. Give me other names that you call them out here. Kitula, you see, kindukulu. That's the one and the same thing. And for the cannabis, they are more of like more of psychotic symptoms. See, kama for cannabis, it really alters your brain, and the chemistry in your brain is mixed up. So for them, you'll find this person has lost a lot of weight because they have decreased appetite. And you see, when someone is using cannabis, they eat a lot. Those people really eat a lot.
Because they see a lot of food wanaonakiwa kidogo.
That could be one thing, but also because the brain is in a hurry, they need a lot of energy to do the things they do. Because that person can even walk from the Tag Hotel to Juja 3 times without stopping. So they need a lot of energy for those activities. So in this case, when they stop taking the weed, the appetite diminishes, and that's where the weight loss comes in. They are very restless. Hatuli huyo mtu akona anxiety. Ukona kiwewe. Ni kama you're in a constant state of worry. And you're very restless. Also the psychomotor agitation. Hawezi tulia mahali pamoja. Ako hapa, ako pale.
You're just busy.
You're just busy. And we've also said about the nervousness. The nervousness, the anxiety is inakuja pamoja. These people, when they are withdrawing from cannabis, they are very irritable, highly irritable. And if maybe you're experiencing such from your child, you can try and find out. Wanakasirika haraka. Very highly irritable, and they can get physically aggressive. Wanaweza hata kuchapa. Kitu kidogo tu hivyo, amesha snap.
Ama afanye tu anything crazy.
Anything, they can do anything, because now the brain was used to some kind of activation, but now that psychoactive drug is no longer there. So they are just they can do anything. Another one is the heart palpitations. Roho inapiga haraka when you're trying to withdraw from now, especially the inhalants. Inhalants ni zenye zinapitia kwa the ones that you inhale, the smoke, ama zile za those ones, the heart beats really fast.
The tobacco ones.
Yes, those ones. The heart beats really fast, and you're not able to control it. Also in alcohol, in cannabis, there is also sleep disturbance. Unapata huyu mtu haizi kulala, ama kilala anapata nightmares. So in most of these symptoms, most of these substances, the withdrawal symptoms are almost the same. So when you're experiencing them, if you experience one of them, don't wait for it to go away. Sometimes they don't go away. Sometimes you need medication. In terms when we will get that treatment, that you will need, or we can just right away go to treatment from here. You can get treatment before we go to treatment for the withdrawal symptoms. Remember to listen about intoxication. Intoxication, you could be intoxicated and you're not addicted. You're intoxicated by alcohol and you're not addicted. For example, our watu wa Kirinyaga, you remember there's a group of people that died. I don't know, they were 17 or 7. I am not sure of the numbers, but they died because of the alcohol intoxication. So in that line, the alcohol gets into your body or that other drug, and it damages you, inakuharm. It could be short-lived or high-lived. That's where unaweza pata mtu anatapika, ako na nausea, ameanza ako moody. Hiyo alcohol umeikunywa ni kama when you're having a stomach upset. Maybe you have had food poisoning. When you have had food poisoning, tomorrow after treatment it might not be there, and you might not even have a problem. Tuseme you ate an egg and you experienced the food poisoning. After that you might not even have a problem with the egg. But that's the same thing with alcohol. Umekunywa pombe ikakuharibikia hiyo siku, but tomorrow you might use it and you're okay. But again, this intoxication, they can really cost your life very fast. Yes. So you can, it's good for mtazamaji wetu aweze kudifferentiate when they are having addiction, when they are intoxicated, suicide and when they are having withdrawal symptoms.
I love the fact yenye unasema ni vizuri pia mtazamaji aweze kudifferentiate when they are having addiction, withdrawals and all that. So talking of that, lately there will be kumekuwa na vitu zina happen. Unapata a lot of young generation, unapata mtu maybe ali-indulge in alcohol, akaingia maybe kwa cannabis and all that, and they end up kukufa or they maybe accident or talking of the story that is trending right now, the Chira story. Naona because of maybe kutumia drugs ndio mambo ilienda vile kulienda. So what can you say about that?
Okay, thank you very much, and even in fact thank you for raising that, because even in our current, as we are here today, the thing that's going on even in our social medias, in our national TV, in our media houses, it's about the alcohol addiction, and even our deputy president is fighting a lot the alcohol because of the effect it has caused, especially on young people. It is so sad. In a case of a young guy, a very promising talent like Brian Shira, I understand by the time the accident was happening, the guy was intoxicated. If you look at it, most of the people that have had road accidents, suicide, homicide, they are always under the influence of something. Remember, when you're under the influence, you're not able to make the correct judgment. For example, going with the report that was given, if Shira was not intoxicated, he wouldn't have run to cruise the road, right? If he was not intoxicated, he would have made a different choice. Hange make your choice ya kuvuka tu, and maybe that will have saved his life. Higher. Going back to taking alcohol as something to cope. You know, I listened to his story, and he was talking about where he even had to call off his studies because of lack of finances. This guy is an orphan. So he has had a lot of stressful life events. He could have been taking alcohol to cope from all that, because you know, leaving school at having passed your KCSE, you have very big dreams, you have ambitions, then you go to the first year and in the second year you're not able to continue with the education. That's a frustration in itself. This person was
because you think like it's the end of you. And you see, you feel like that's the end. This guy had ambitions to help the grandmother, the cousins and all that. So not being able to meet that would have been a frustration that he was trying to cope with. Hanging out with friends that were constantly using the drug could also have been a reason. So we don't know the real reason why he was using the drug. But for the young people out there, I hope they are learning something. That if you're not sober, it's hard for you to make the right choice. And there's a reason why our deputy president is very passionate about this. I don't know whether you've seen him talk about how he lost his brother, his brother-in-law to alcohol, things that could have been avoided. These things, they really don't help. They are more disadvantageous than they are advantageous. So out there, our young people, I wish you really know what you're getting into before you get into it. Don't go with the flow. Don't go with the vibe. I need to use this to fit in. You don't need that to fit in, because in the long run, the effects are adverse. And you might be using with your friends, wao wametumia weed 10 years down the line, kijana ako imara, hata haijamfanya anything. Wao umetumia 1 week, ushaanza kusikia masauti, ushaanza kuona watu. That shows you're not in the right path clearly. So for the young people out here, don't get into something that you don't know how to get yourself out. What are the effects of maybe drug abuse? Because kuna watu wanatumia drugs sana. What are drugs affecting them in their daily basis life?
Thank you. In the cases of the effects, they can both it can both be effects on the individual using them, or on the community, ama the family members they are living with, ama generally the caregivers who take care of them. These basic effects, for example, a youth who's on drugs, a person is definitely going to drop out of school, or they're going to have poor performances. These drugs will bring about the liver cirrhosis. They'll bring about psychological illnesses. They will bring about irresponsibility, where a man goes, akipata tu pesa anaenda anakunywa, doesn't take care of the family. Now all this, you see, they are rounded to the individual, to the family, to the people living with them. Drugs will cause suicide. They will cause homicide. Gilbert, if you look back at the stories that have been trending in our media houses of femicide, of homicide, in most of those cases, the victim, not the victims, the perpetrators are always intoxicated. Very few of them who have committed those crimes when they are sober. So most of these drugs are going to cause you to alter your judgment, where they are going to make you make choices that you're definitely going to regret. Huyo mtu unajua akifanya hivyo, soberness inarudi, anatoroka. Why do they run away? Because they have now come into a state of reality. What have I done? So when you're using drugs, you find yourself doing all those things, and then unakuja kujiuliza baadaye, nimefanya nini? So these drugs are going to cause you respiratory illness, gum diseases, name them. Every aspect that comes with drug use, uko nje wanazijua zote. Mtu amedevelop reverse cirrhosis because of that. The kidneys have failed because maybe ametumia a lot of drugs. So many illnesses, heart attacks will come, lung diseases will come, all those. They are so varied. They will start having hallucinations. And
not only talking of these diseases, they're talking of like alcohol. We are not talking pia kuna hii the wrong medication, they can affect even, see, wrong the medication in drug abuse. So pia hizo zinaweza affect pia the kidneys, the lungs and all that.
I'll give you an example of a psychiatric medicine by the name Atene. Someone who've been admitted to a medical, to a mental hospital or a rehabilitation will definitely relate to what I am saying. Atene is a medicine that is a medication used to cure side effects of a certain tablet. A psychiatric medication that gives you side effects kama being umekauka ama drooling. Those are some of the things that Atene is used to get away with the side effect. But now this Atene thing is very addictive. So huyu mtu akikuja kwa hospitali tumpe the medication for maybe the medication for schizophrenia, but so that asipate hizi side effects kama kukua stiff, kudrool, tunampea Atene pia. So this person goes and the side effects are not there, but they are using Atene. Atene, you get addicted to Atene. Sasa wewe unakuja hospitali because we gave you a medication and you went, used it, and now you're addicted. You don't know, tunakutibu the mental illness and we're still tibuing the addiction of Atene. So the same thing with kama Piriton. If you take it in your body and haiendi kuponya ile kitu iko, it is definitely going to cause you harm. Yes, utaweza kulala, but in the long term use, it is going to cause you effects.
Okay. So talking of that, are there any somehow maybe treatments that there can be done concerning now drug, how people are affected by drugs? Kuna watu wengi wanapitia sasa alcohol, how can we treat them? Watu wako ndani kwa cannabis, how can they be treated?
Thank you very much. These drugs, the thing with them, you, as I said earlier, you just don't wake up and decide I am done with them. It is going to work for some, but a very minimal percentage. Others, you will need close monitoring, you will need rehabilitation. Rehabilitation is where you're rehabilitated in a place for, it is always 90 days, which is 3 months. In those 90 days, you'll go through psychotherapy sessions, you'll get psychiatric intervention, and also you will get the medication, pharmacotherapy, the medication if you need to. And this one, you will need detoxification. For example, if your body is used to alcohol, lazima hiyo pombe itolewe kwa mwili, in layman's language. That is called detoxification. You go through a toxicology test where we are able to identify the type of drugs you've been using. Then after that, we are able to now detoxify them as you use medication to stabilize you. For example, if you're experiencing hallucinations, you will need medication to get away the voices. You will need medication to stop feeling the tactile hallucinations. And continuously, the best and the most effective treatment is psychotherapy, where you're taught how to change this behavior. Remember, this is a behavioral disease. It's a behavioral disorder because it is a habit you acquired. There's someone who was trending and they were saying a habit is a disease. They've never taken alcohol because a habit is a disease. So because that habit has now become a disease to you, we need to eradicate that behavior and equip you with a different one. If you're used to coping, if you're used to fighting depression via alcohol, we need to give you a healthy coping mechanism. So continuously helping you get away from the company that was making you use hizo behaviors zote. I might not be able to finish them here, but when you come to us, that's where we help you to change easy behaviors, how to change your life so that you're able now to live off addiction, off withdrawal symptoms, off intoxication, all these drugs. You come to us. If you need psychiatric help, we are definitely going to give you the right referrals. Yes.
Wow. So mtazamaji, as we continue, because tunaelekea bado dakika kidogo tukiwa tunamaliza, but as she has said, if you really need a help from them, tutakuwa tunaweka nambari hapo. You'll just call them, ama you can write a message if you are going through something, some addiction you want to stop. If you want to stop, maybe stop your addiction, just talk to them na utakuwa unasaidika sana. Tena zaidi, nambari iko hapo chini ya screen yako. Make sure you call them, make sure you text them on WhatsApp, on the message za kawaida, na zitakuwa utakuwa na wasaidia. So there is a question that has come right now. Somebody is asking, does drugs affect pregnant women ama the foetas?
Okay. Thank you. That's a very important question. I have seen women out here wakiambiwa when they are pregnant wakunywe Guinness. I will not affirm and I will not object on that.
Guinness, you will not object on that?
I will not affirm and I cannot stand here and tell you the science behind that.
Okay.
But I know the science against that. When you're using a psychoactive drug, alcohol is a psychoactive drug, nicotine is a psychoactive drug, and that's why you find even when someone is pregnant, they need to take care of themselves and of the fetus. In cases where this mother is taking those psychoactive drugs, you will find it is going to bring complications in your pregnancy in the highest percentage. They will experience premature births, low birth weights, where this child, even after birth, they have stunted growth. So that will be a reason of what you are using during pregnancy. They can also cause stillbirths, and in cases of severe alcohol intake, I don't know how severe, but in case where you're using alcohol during pregnancy, you're going to get this child who is going to have a condition we call FADS. Inaitwa foetal, it is a foetal alcohol spectrum disorder. It's foetal alcohol spectrum disorder. It is FASD. Yes, spectrum disorder. The characteristics of this, utapata you're getting a child with a very thin face, ama the upper lip is very thin, the eyes are sunken na huko ndani. A characteristic that you're definitely going to know, this child is not okay. You will have done better for that child. So when you're pregnant, it's only for 9 months. Just avoid all that you're using. And in cases where they're using heroin, it is so bad that if you're using heroin and you're pregnant, your fetus gets addicted to the heroin. You see, the fetus is not born, but utazaa mtoto wako addicted to heroin, that which will lead you to having mtoto undergo withdrawal therapy or withdrawal medication, withdrawal session from the heroin. Juu alizoea, but hajazoea juu anaikunywa, alizoea juu it is passed to the fetus through the placenta. So in case where you're pregnant, try as much as possible to avoid on this psychoactive drugs. Wow. In case you're pregnant out there, try not to avoid, try not to avoid, avoid by all means.
Avoid by all means.
Yes.
Unajua kuna mahali nimesikia you should not affirm and nini.
I don't affirm or deny.
Yeah,
but
deny.
I don't affirm them to take the drug.
Hata it's not right.
Yes. I just don't have the scientific basis where they say Guinness will help you during pregnancy. I don't have the scientific basis. But I can't be able to stand here and confidently tell them it might affect them in the long run. Yes.
Because you hata yeye mwenyewe itamuaffect.
Hata yeye mwenyewe itamuaffect. Because tell me if you're drunk, there are those supplements that you take during pregnancy. You need good nutrition.
Yes.
You need rest. You need good sleep. You're definitely not going to get all that when you're intoxicated. Yes.
Kuna mtu
anauliza,
anauliza
going to take you to do promiscuous behaviors. Yeah.
Kuna mtu anauliza kuna mtu akiwa pregnant anakulaga mawe. Does it help?
Yeah, it helps. That one is not even a mental health. It's a craving, and it might. They know what they feel. Yes, and there are some people who might not even look at it. That's just a. It is a pregnancy craving.
Oh, okay.
But mawe is your drug, so that one is okay. They can take.
Okay,
yeah.
Okay. Me thinking of the others. Jua mawe inaenda kwa fetus, unajua.
It is helping them grow. Those mawe have calcium. Yeah, so it is helping in the growth of the bones of the fetus.
Okay.
Yes.
Well, that was a very, very good.
Yes.
Tunataka kusema like naona pale we are we like 4 minutes tumalize. Do you have any word you can add on that?
Yes. On topic drugs.
Yes.
Drug substance use disorder is a very broad topic that even if we stay here the whole day we are not going to exhaust it. So even ndivyo naambia mtazamaji wetu, do not take drugs for fun. As I said, do not start a fire that might not be able to put off.
Yes.
It is all fun and games until you cannot be able to stop that on your own. Until you cannot wake up one day and say sitatumia pombe. Until all your finances are drained by the drug. Until you cannot function without that drug. Umeanza imefika mahali unachukua hadi vitu za mke wako unauza. Unaingia kwa nyumba unachukua sufuria Gilbert unauza, so that you can be able to sustain that craving and that addiction. Because addiction is so bad that it makes you even a thief. You're not even trusted by those people you live with. And that is one thing. When you're doing that, think about the people around you. For example, in our Mount Kenya region, as our deputy president is saying, unapata a man is 50-year-old, anaishi na mama yake, hana bibi, hana mtoto, ama hata alikuwa na bibi na watoto, but they ran away because they cannot be able to condone the drinking behavior. This guy comes to their elderly mother to eat. Akikunywa anamtusi sawa sawa, anatusi mama yake sawa sawa. And this mother is old, at old age, anafaa kuwa you should be taking care of your mother, but now it is the other way around. So when you're starting something, look at the long-term effect. Look at where do I want to go with this? Why am I even doing this in the first place? If you have to use the alcohol, use it in controlled measures, such that it doesn't affect any aspect of your life, be it social, spiritual, physical, or even occupation. Yes.
Or even emotional.
And do not use drug as a coping mechanism. That is a very unhealthy way of coping with your stress, with your depression, with any mental illness. Do not use any drug as a coping, because it only worsens on the situation. Yes.
Somebody is watching there and anauliza, where can I reach on you? Where are you located, so that maybe I'm going through something? Tutawapata wapi?
So where you're going to get us, we are located along Thika Road, Spa Mall. It is near Kimbo. Get us at that floor, room T9B, okay? And now we have a number that you can reach us. And before you give the number, we can always have, we offer online sessions and we offer physical sessions. If you're not able to come to where we are, give us a call. And please do not reverse call, because if you reverse call, unanyima hao wengine chance. Maybe someone who had a real need, you're denying them that chance to be able to talk to us. So call us to book an appointment, text us on your issue, so that we can be able to book an appointment for you, so that you can be able to see us. And the number to reach us on is 0759557051. You're going to get it down there. And in case you've missed any of our previous episodes, make sure to catch us on our YouTube channel, MASSA TV. And thank you for keeping us engaged.
Yes, and of course we thank you so much for every person na amekuwa part of this tangu tuanze. Thank you for your patience. Thank you because you have learned a lot, and I thank you because I know mtakuwa mnatafuta our psychologist Grace Lucy, and of course trust to me utakuwa unasaidika sana tena zaidi. Usikubali addiction, usikubali stress zikupate na uko pale, and of course you have somebody that can help you. Reach them with the number down the screen na utasaidika sana tena zaidi. Kama kawaida, hii imekuwa mental health show ndani ya MASSA TV. Mimi nimekuwa wako presenter Gilbert. As she has said, make sure unapitia pale kwenye MASSA TV YouTube and uone the previous content, the previous mental health show ziko pale, na najua zitakuwa zinakusaidia zaidi. And of course make sure you subscribe, pitia pale kwenye Facebook pia ziko pale, na Mwenyezi Mungu atakuwa na kubariki zaidi na zaidi. Tulisema mental health ni mimi na wewe, tusaidiane, tukuzane na tuelimishane. Until next time, goodbye and have a blessed week.